Hello, my health enthusiasts. Welcome to Healthy Healing Habits, where we will embark on a journey of wellness. I am Amara, a healthcare professional who aims to guide you to a healthier and happier lifestyle. As you get ready for an informative treat, please do subscribe, hit that bell, and let's get educated. Today's discussion surrounds stroke recovery. What do you know about stroke recovery? This is a difficult time in the lives of stroke patients, as it is a traumatic and depressing experience as their daily activities become a little more challenging. But do not fear, help is here. One may ask, what is stroke? An ischemic stroke happens when the blood supply to a part of the brain is blocked or reduced, preventing brain tissue from receiving oxygen and nutrients, where brain cells begin to die in minutes. Hemorrhagic stroke, however, happens when a blood vessel in the brain leaks or bursts, resulting in bleeding in the brain. The blood increases pressure on brain cells and damages them. Now, let's get into some of the common symptoms of stroke. 1. Difficulty speaking, where words are slurred and not easily understood by others. 2. Numbness, weakness, or paralysis in the legs, arm, and face, which usually occurs on one side of the body. A comparison can be done to see these changes. 3. The ability to see from one or both eyes due to blurred vision. 4. Headache and dizziness may occur. And 5. Difficulty walking, as leg muscles tend to become weak. Now bear in mind, in the case of a stroke, think and act. FSTR. FF for face drooping. A for arms weakness. S for stability, that is walking and balance. T for talking ability, that is slurred speech. E for eyes, the ability to see, and R for reaction and reaching out for help. Stroke is known as one of the common cerebrovascular diseases that has negatively impacted human health and life. Its incidence and mortality rates are high, with survivors suffering from different degrees of disability. After a stroke, the injured nervous system can be adapted to the external stimulation, and the damaged nerve tissue can play a compensatory role. The damaged nerve cells can grow axons and dendrites again, which is beneficial to reconstructing the neural pathway. Therefore, the training stimulation can promote the reconstruction and recovery of nerve function. Simultaneously, the study suggests that rehabilitation treatment of cerebrovascular diseases should not be limited to some treatment methods, but should be combined with various rehabilitation treatment methods according to the actual situation. Let's get into the finer details of this video. The treatment options of stroke recovery, which includes but is not limited to herbal supplements. Herbal supplements such as ginkgo biloba, gotu kola, turmeric, and ashwagandha are recommended in stroke recovery therapy. Ginkgo biloba is a popular herb used in medicine, as it is believed to have cognitive and circulation benefits. It contains 2 of 40 compounds, flavonoids and terpenoids, which are the key components that provide medicinal benefits. Flavonoids are known as plant-based antioxidants. Studies show that flavonoids protect the nerves, heart muscle, blood vessels, and retina from damage, while terpenoids, such as ginkolaids, improve blood flow by dilating blood vessels and reducing the stickiness of platelets. Gotu kola is a perennial plant that is native to East Asia, South Africa, and the South Pacific. It is known as a member of the parsley family with no taste or smell. Its leaves and stems of the gotu kola plant are used as medicine. Several small studies suggest gotu kola may help reduce swelling and improve blood flow. Ashwagandha is an evergreen shrub found in India, Africa, and the Middle East. It is commonly used as a medicinal plant over the years. It contains several bioactive compounds, including withanolides, which have been associated with anti-inflammatory and antioxidant effects. Nowadays, ashwagandha supplements are often promoted for stress and anxiety, sleep, male infertility, and athletic performance. Bear in mind, ashwagandha may be safe when taken in the short term, up to 3 months. These herbal supplements are available in various forms, that is, capsules, extracts, or teas. Turmeric is known for its anti-inflammatory properties. Turmeric contains curcumin, which may aid in stroke recovery. It can be consumed as a spice in food or taken as a supplement. Studies suggest that turmeric may prevent platelet buildup along the walls of an injured blood vessel. Platelets collecting at the site of a damaged blood vessel cause blood clots to form and contribute to blocking the artery as well. Turmeric is promoted as a dietary supplement for a variety of conditions, including arthritis, digestive disorders, respiratory infections, allergies, liver disease, depression, and many other ailments. Next is omega-3 fatty acids. Omega-3 fatty acids are found in fish oil supplements, flax seeds, and walnuts. They are beneficial for heart and brain health. They can also reduce inflammation and improve blood flow. Omega-3s are important components of the membranes that surround each cell in your body. Omega-3s provide calories to give your body energy and have many functions in your heart, blood vessels, lungs, immune system, and endocrine system, the network of hormone-producing glands. A 2020 study suggests that taking 1 gram of omega-3s daily prior to having a stroke lowered the risk of functional limitations and physical disability after a stroke. The strongest evidence for a beneficial effect of omega-3 fats has to do with heart disease. These fats appear to help the heart beat at a steady pace and not enter into a dangerous or potentially fatal erratic rhythm. This next treatment option one may be fearful, especially for the first time. But do not to fear, a small needle prick will not cause you harm. Acupuncture is a traditional Chinese therapy involves inserting thin needles into specific points on the body to promote healing and improve circulation. It may help with motor function and speech recovery post-stroke. Acupuncture has a better short-term and long-term clinical effect on stroke patients, improves motor dysfunction, and improves the quality of life and independence of patients with stroke. With the increase of acupuncture treatment times, the rehabilitation effect of patients will be better. Acupuncture promotes the formation of the central nervous system and cell proliferation. Ready for some relief and relaxation? Yes, I believe so. Massage therapy is another treatment option which involves gentle massage can improve circulation, reduce muscle stiffness, and alleviate stress. It can be especially helpful for stroke survivors experiencing muscle weakness or spasticity. Another treatment option is physical exercise. Regular exercise, tailored to individual abilities, can aid in stroke recovery by improving strength, balance, and mobility. Activities like walking, swimming, or yoga can be beneficial. Physical exercise improved mental function, such as one's mood and depression, reduce the risk of stroke recurrence, reduce the risk of heart-related conditions, for example, by reducing blood pressure, obesity, and also reduce the risk of falls. Research shows that there is a critical time period up to 6 to 8 months after a stroke when the most recovery occurs with rehabilitation. Some common exercises include knee extensions, seated marching, ankle dorsiflexion exercise, tabletop circle exercise, unweighted bicep curls, open arm exercise, wrist flexion and extension, just to name a few. Now let's take into consideration meditation and mindfulness in stroke recovery. Practices like meditation and mindfulness can reduce stress, improve mood, and enhance cognitive function, which are important aspects of stroke recovery. Daily meditation can be beneficial for stroke recovery as research has shown that it can reduce depression, tiredness, and fatigue, improve attention, emotional regulation, and mental flexibility. Dietary changes. A diet rich in fruits, vegetables, whole grains, and lean proteins can support overall health and aid in stroke recovery. Foods such as fish, eggs, Greek yogurt, avocado, nuts, seeds, olive oil, salmon, flax seeds, legumes, tomatoes, and citrus. Fruits are best to consume during stroke recovery. Reducing salt, sugar, and saturated fats intake is vital for heart health and the prevention of stroke recurrence. Aromatherapy. Aromatherapy involves the therapeutic use of essential oils as complementary medicine to treat many physical and emotional diseases and to promote patient health. Certain essential oils like lavender, rosemary, and peppermint may have calming or stimulating effects that can help with relaxation, stress reduction, and mental clarity during stroke recovery. Essential oils possess anti-inflammatory and antioxidant properties, as well as purported psychological effects that may alleviate somatic and emotional diseases. While using essential oils for stroke recovery will not remediate all stroke-related symptoms, they may help relieve certain secondary effects of stroke such as anxiety, fatigue, and insomnia. Just as every stroke is unique, each essential oil has unique properties that may be able to relieve specific ailments. Aromatherapy can also improve somatic symptoms, such as blood pressure. Even with these recovery methods suggested, it is essential to consult with your healthcare professionals before starting any natural remedies, especially if you're undergoing medical treatment or taking medications, to ensure they're safe and appropriate for your individual needs. Additionally, these remedies should not replace standard medical care but rather complement it as part of a comprehensive stroke recovery plan. As suggested by the American Heart Association, American Stroke Association, AHA-ASA, primary prevention of stroke eliminates the use of e-way, cigarette smoking, improved physical activity, body weight management, being dyslipidemia, hypertensive, and diabetic. If you are diagnosed with any of the above-mentioned disorders, then these addressed or managed to decrease the risk of stroke. This is where we end for today. Thanks for tuning in to Healthy Healing Habits. Leave your comments below and subscribe for more. See you next time. Stay healthy and happy.